Hi there, everyone. I'm Dr. Roy Hemingway, sometimes known by my Jewish name, Israel Ben Heman. And I'm making a new video today because I've done something which, for me anyway, is a little bit extraordinary. I haven't done it before. I've been doing some research lately, and I wanted to let you know about it because if I don't let you know about it, the chances are that you'll never hear about it, and that would be a shame. I'm a cardiologist, and I've been putting some facts together over several years, but more recently, in the last 7 or 8 months, more information has been flooding in to my desk. Actually, it's been coming like it was coming through a fire hose. So much information that had previously been left behind. Let's put it that way. It hadn't really been hidden. It had just been left behind, behind this door or that door, or had a curtain drawn across it. And I put all that along with my other studies, and I put it together as an analytical paper, a scientific research, if you will. And now I'm publishing my findings in this paper, letting everybody know what I think. I've discovered a way to beat the biggest and most prolific serial killer the Western world has ever known. It's called cardiovascular disease, ischemic heart failure, atherosclerosis, LADMI, that's left anterior descending coronary artery myocardial infarction, in other words, a heart attack. But this particular heart attack, this particular type, is called the Widowmaker. Excuse me, we've got 26 dogs here on the farm in the Philippines, and they bark like hell sometimes. We've got one of them going crazy at the moment. I'm going to throw a bucket of water on him in a minute. We've been here in the Philippines for just over a week. It's great to be back in our farmhouse. But the surrounding noise is unbelievable sometimes. 26 dogs, which are all rescue dogs, and my wife loves rescuing dogs, and so the noise gets unbearable sometimes, so please bear with me. So, go back to what I was saying. I've put together this paper because I believe I've found a way to shut down this massive killer, which is a cardiologist's nightmare. There are so many people across the Western world who are dying needlessly in their 30s, 40s, 50s, and so on. The numbers are absolutely incredible. I'm not going to start quoting them all here. I've put all my findings down in note form, which you'll find below this video, down there. I believe I found a way to ensure that cardiovascular disease almost gets stopped in its tracks. It's not a new drug or anything like that. It's not even a new idea. It's a new implementation of an idea that has been on the table for a very long time, and that is taking care of yourself. Watch what you eat. Don't get overweight. Don't smoke. Don't drink alcohol. Don't use recreational drugs. Get plenty of exercise. And that sort of thing. But here's the thing. This is where I've done something a little bit different. What I am putting together is political beliefs that have driven cardiovascular disease to the point where it is today, and allowing for all of the wokeists out there and the feminists out there. Guess what? You are your own victim. You have created a system that kills people of cardiovascular disease. Why do I say that? It's simple. At the turn of the 19th century, as we entered into the first decade of the 20th century, a family doctor coming across one man with angina or extensive vascular disease was the highlight of his day. It felt something I hadn't seen before. It just wasn't there. It was, but it was so rare. And the reason for it was people back then didn't have the money or the resources to eat too much. They didn't have the possibility of a sedentary lifestyle. They didn't have the medicines that are available today, because this was the years before Alexander Fleming stumbled across his great discovery, penicillin. So at the turn of the 19th century, the biggest killer in the world then was infection. A simple graze after a fall, a cut from a kitchen knife, or a bite from a dog, anything like that. Would you believe even insect bites would turn deadly and people would die of them because of infection? That was the greatest killer of the time. It's no longer the case. Today, we take a 5-day course of amoxicillin and pretty much all your ailments disappear. It's not quite that easy, but you get the point. You know pretty much what I mean. So then we started getting into the 20th century, and as we progressed through the 20th century and things became easier to get, easier to do, and political systems began to move the goalposts into the sedentary lifestyle that many people love today, people started to get very lazy. So they started to get fat. And they started adding salt to their lunch and various things like this. And cardiovascular disease went through the window. It went absolutely through the roof. It went absolutely crazy. Now, over 1 million people across the world die every year from cardiovascular disease. That is a low figure. It's not a high figure at all. That's a low figure. I'm lowballing it. Because I don't want to get into the argument of just how many people die from cardiovascular disease on a regular and daily basis. But it's amazing how many people do die of it. Now, I came across a couple of things, and like most things that you discover, very often you discover them, if not entirely by accident, then partially by accident. And this scenario, in my case, is very similar. People are dying of cardiovascular disease, yes. But what's more important is they're dying at a faster and faster and faster and ever more accelerated rate. When I look at one of my patients and he's lying on a hospital bed and his doctor is looking at his family and sort of looking quite downcast and shaking his head, looking down at the poor man laying on this hospital bed. He's dying and he's only 39 years old. Now, right there, that's the enemy that I spent years learning how to fight. It's called early death. That is the enemy. And anything that takes away human life before it's allotted 70 years and 10. So the problem that I have with all of this is, how do I find a way to prevent cardiovascular disease taking away the lives of so many millions of human beings across the world without discovering or inventing some international all-encompassing panacea? How do I get that miracle drug into the systems of all the people to prevent this disaster from taking place? The truth is, I don't have it. I don't know, maybe I'm just not smart enough. But it seems that neither is anyone else, because we still don't have it. We don't have that miracle drug that will clean your arteries. We don't have the miracle drug that will stop you puffing and panting when you're walking up a flight of stairs because you're out of condition. We don't have that miracle drug. But I'll tell you what we do have. It's not all bad news. Some of it's good news. And some of the information that I'm basing my findings on came from people who couldn't be bothered to get off the couch and even go and take a walk in the sunshine on a Sunday afternoon. They were too busy playing video games or something like that on their iPhone, or a console in their hand playing whatever it is with their kids on the TV. They were too busy doing all of that, and those people gave me a lot of information which I'm now going to use, but also going to cite the political systems that have driven it. Now, first of all, what do I mean by the political system? Okay, one particular political ideology that certainly raised the number of women who are dying of heart attacks, if not the first heart attack, then certainly from the second one, is the feminist movement. The feminist movement said, we don't need men. We don't need men for anything. We can go into the workplace. We can do heavy labour. We can go and sit at a desk for 9 hours a day. We can do this and we can do that. Hell, we don't need men to get pregnant. We can do it all by ourselves. That's what they did. They emasculated all their men so that men didn't want to fight for them anymore. They trod down on men and said, well, you know, the government's on our side, and every time you say something we don't like, we can have you arrested and thrown in jail. And the women, slowly but surely, drifted into the same lifestyles that men had been in. You see, post-1950, it were men. It was men that were dying of heart failure, heart attacks, strokes, because they were the guys that were involved in heavy industry. They were getting lung diseases. They were the ones who were straining their hearts. They were the ones who sat like a couch potato at a desk from 8 o'clock in the morning till 6 o'clock in the evening and grabbed a heavily salted hot dog for lunch, they were getting the heart attacks. But the moment feminism got women to move into and take over many places in the working environment that had previously been occupied by men, women too started having heart attacks. And sure enough, as of today, less than a century later, women are dying of heart attacks, ischemic stroke, and heart failure as many as men, and as often. And here's the funny thing. When it comes to an LADMI, a left anterior descending coronary artery myocardial infarction, this is once called the widowmaker. When it comes to this one, more men survive it than women, because men are stronger. Now, I don't care about your feminist values, even if you're offended by that. I am telling you a clinical fact. The density of muscle in the male is greater than that of the female, and provided that muscle is supplied with oxygenated blood, that individual, the male, is stronger than the female. Not only that, females found that they had a tendency to put weight on faster than men if they were in a sedentary job, sitting in a desk from 8 in the morning till 6 o'clock at night and eating a salted hot dog for lunch. Well, you see now the problem. As many women as men are dying of heart attacks. And the men and the women are dying of heart attacks in ever increasing numbers. How do we stop it? Well, let me tell you a true story. There was a gentleman, and I'll call him a gentleman advisedly, because he's certainly worthy of respect. He was a special forces operative in several conflicts. A decorated hero, came home from 27 years of loyal and dedicated service, and went into heavy industry, working for himself, but it meant lifting and carrying a great deal of heavy materials day in and day out. And like most people who work for themselves, he probably overdid it a bit, working 12 to 14 hours a day. He didn't retire at the age of 65. He didn't even retire at the age of 70. This guy just didn't know when to quit. And at the age of 72, he was sitting at home, and it was a day off for him. And he was catching up on a bit of paperwork on his computer. While he was sitting there, he noticed his ankles had begun to swell up. Lower extremity edema. His ankles were filling up with water. Now, prior to this, he'd had himself a bit of a barking cough, which his doctor kept telling him was bronchitis and a bit of asthma. One doctor even told him he just had a cold. I think I might have been inclined to just investigate that a little bit further, because it sounds an awful lot to me like asthmatic heart failure. However, No one noticed it. But when he noticed the swollen ankles, he decided he'd better go to the clinic, the emergency room. And he did. Off he went. And as it would come to pass, he met with a very young and fairly recently qualified doctor who was on duty that day, and he, being on the ball, as it were, right up to spec, he placed the guy on an EKG machine. I call it EKG, you can call it ECG if you want, electrocardiogram. The original development of the electrocardiogram was invented by a German guy, and so cardiogram in German starts with the letter K, so it's EKG. But we start it in the English-speaking world with a C, so it doesn't matter which one you do, EKG or ECG. But that's what he put him on. And sure enough, there was a little glitch in the P wave. I won't go into all the details of P waves and QRS complexes, T waves and so on. You get used to reading the graph from an electrocardiogram. And there was a little glitch there in the P wave. And the doctor, not wanting to set any panic into the patient, said, look, there's a little glitch here, I'm not sure what it is, it's only a small one. But he said, look, just to be on the safe side, I want you to go to the hospital, present yourself to the emergency room, and he said, we'll go from there. So the guy said, yeah, okay, best to be on the safe side, you know. And the doctor said, we'll call an ambulance for you. And the guy said, no, don't bother. He said, I'll go to the hospital on my own. So I've got my motorcycle outside. And he rode his motorcycle to the hospital. And he presented himself to the emergency room, where all and sundry were completely baffled. They didn't have a clue what was wrong with him. They were about to discharge him when another young doctor came along and said, wait a minute, you shouldn't have swollen ankles. Now, they were doing the tests on him. His blood pressure was normal. His heart rate was normal. He didn't have cold sweats. He didn't have any pain. Nothing. He had only one symptom of a heart attack, and that was swollen ankles. So they did a test, a blood test. And the test that they did was to search for an enzyme called troponin. Troponin is secreted by the myocardium, which is the heart muscle, when it's under attack. Heart attack. And sure enough, troponin was present. So then they knew the guy was actually in the process of having a heart attack. Not just any old heart attack. This guy was having a widowmaker, a left anterior descending coronary artery myocardial infarction. They gave him a handful of diuretics and a handful of aspirin to thin his blood, make life a little bit easier. And then they got him onto a scanner, and they did ultrasound and MRI and so on. And sure enough, there it was. A 99% blockage of the left anterior descending coronary artery. The chances of survival, not just being able to remain alive, But the chances of survival without any kind of injury, long-lasting invalidity, the chances of surviving it in the first place are close to nil. The chances of surviving it without lasting effects are, I mean, the 1 in 600 billion. This guy had no pain, didn't have a cold sweat, he wasn't even nervous. And the odd thing is, something called an ejection fraction. What that is the left ventricle of the heart, the lower left chamber of the heart. There are 4 chambers. The lower left chamber pushes blood out of the heart, which then circulates around the body, carries blood to all the organs, the muscles, and so on. The amount of blood that actually squeezes out at each beat is not 100%. Actually, if it was 100%, there'd be something wrong. Normal is around 70-ish. For women, a little lower. But men, 73, 74, 75. And at 75% ejection fraction, everything's hunky-dory. And this guy's ejection fraction was exactly that, 75%. And he was in the middle of a heart attack. Now, when I interviewed this guy, he said he tried to convince his doctor at the hospital, the cardiologist, that whilst they may have found troponin, it wasn't possible that he could be having a heart attack because he wasn't distressed, he wasn't breathless, he hadn't broken into cold sweats, he didn't have a chain of severe pain down his left arm, or like an elephant sitting on his chest or his back, pain deflecting into his neck, spine and lower jaw. He didn't have any of it. And he said to the doctor, he said, it can't possibly be a heart attack. And the cardiologist kept probing, he kept looking, and he said, I'm sorry, but you're wrong. He said, I don't know why you can't feel it. But he said, you are having a heart attack. Now they put him in a bed and they kept him in the hospital. And 2 days later, he went to see the surgeon, the cardiac surgeon, who inserted a stent. They put it in through the wrist here, tiny little cut in the artery, threaded in a catheter, and by transcatheter delivery, a stent was inserted into the left anterior descending coronary artery. It was then expanded, thereby crushing the plaque into the artery wall, and the clot with it, the blood clot with it, and suddenly reperfusion of the myocardium re-engaged. In other words, his heart started to get oxygenated blood at the usual rate. Now, that's all very extraordinary, but you know what's even more extraordinary? This guy has got absolutely zero damage to his heart. You ask any cardiologist and they'll tell you the same thing. That's impossible. A 99% blockage, a 99% occlusion of the left anterior descending coronary artery And not only is this guy still alive without ever feeling an ounce of pain, without showing any signs of it whatsoever, except that there was troponin in his blood and his ankles were swollen. Not only all of that, but now he has absolutely zero damage to the myocardium, to the heart muscle. Now normally you deprive the heart muscle of oxygenated blood and it starts to die. And it doesn't start to die after a couple of days. It starts to die immediately. And the heart muscle does not recover. It stays scar tissue where that damage has occurred for the rest of your life if you survive. Any cardiologist worth his salt will tell you it's almost impossible to survive a widowmaker with a 99% occlusion. This guy didn't just defy the odds, he absolutely got hold of the odds and kicked it in the ass. And all the way down the street. But what could it be that saved this guy's life? I wanted to know. And today, I do know. This guy has something called a collateral blood supply from main arteries to his myocardium. In other words, his heart has grown extra blood vessels, which is supplying oxygenated blood to his heart. And that's why his heart didn't stop beating. That's why he didn't have any pain. That's why he didn't have cold sweats. That's why it didn't kill him. Because his heart has some extra blood vessels. What his heart did was develop an emergency bypass. So if he ever had a heart attack, those blood vessels would carry on, allowing blood to flow to the myocardium. And then a doctor could come along and stent his blocked artery and everything would return to normal without any damage to the heart. That's exactly what really happened. Now, many people are going to say, that's not possible. I don't care whether you believe it or you don't. That happens. And what's more, this isn't new news. Cardiologists have known about this for a very long time. So the answer then, to prevent people from dying at the age of 28, 36 and 48, the answer is to get everybody to grow extra blood vessels in their heart. And you know how they do that? The same way this old guy did it. And by the way, when I say this old guy, I promise you, you wouldn't believe how old he is when you look at him. He's now 74 years old, and he looks 30 years younger than that. This guy was special forces when he was in the military. And then he went into heavy industry. You see, he was constantly putting his physical existence under enormous strain. His body got used to it. And to make sure that his body didn't overexert itself and have a problem, his heart grew some extra blood vessels, because that's what was needed, because of the amount of work that he was doing. That's what saved him, and that's what can save you. It can save everybody. A collateral blood supply. How do you get that? It's simple. Watch what you eat. Don't drink alcohol and do not smoke. Do not take recreational drugs. get up off the couch and go play football. Go play golf. Go play tennis. Go for a walk. Go for a jog. Put your body under stress. Don't do it 2 days a week. Do it every day. My proposal is, and this I make clear in my paper, we need legislation here to inject into the educational curriculum of our children a physical athletics program that they can follow from the age of 7 up to the age of 10, and then from the age of 10 to go on to some serious circuit training and really difficult, arduous, body under strain exercise, and do it every single day. There's no need to bust your gut. There's no need to develop a hernia. There's no need to start tearing muscles. You just have to keep moving. If you sit on the couch, sipping a cold one and smoking a 20-pack of fags every day, you're going to have a heart attack and you're going to die of it. But if we inject this into a curriculum for our children, they will carry that on from the age of 7 to the age of 18 when they leave school. By that time, it will be a daily habit, and they'll carry on doing it. Some will stop, and those few who stop will eventually die of heart attacks. But those who don't stop, those who continue with their habit and make it a lifetime habit, will develop a collateral blood supply from their arteries surrounding the heart, which will provide oxygenated blood to the myocardium, the main heart muscle. And if you then have an LADMI, you'll probably survive it. Here's the thing. Our friend that we're talking about is now 74 years old. Like I said, he looks 30 years younger than that. Wouldn't it be nice to have that gift? But he does. He looks 30 years younger. He is fit, he is strong, and he is healthy. He's had a little glitch. In terms of physical injury, instead of having his body torn in half by something that he couldn't control, he got a little bruise on his elbow. In other words, the heart attack that he could have had, the devastation that could have followed it, would have been like having his body torn in half. But what he actually had, because of that extra blood supply, was a little bruise on his elbow, which he recovered from almost immediately. 2 days after this guy had a stent placed in his heart, he was sitting on an aeroplane, flying off on his holidays, where he tells me he had an absolutely fabulous time. Swimming, diving, surfing. He said he'd never done that before, but he thought he'd give it a try. This guy's just had a heart attack. And he's now got a stent in the major artery supplying blood to his heart. And he just shrugged it off like it never happened. Most people are in a wheelchair for the rest of their lives. See, what I'm saying to you is, if you want to live through these little glitches, I mean, this wasn't something that was going to put him in a wheelchair for the rest of his life. To him, this was a bellyache. He survived it, but he didn't just survive. He came through it like it was nothing. And all because his body had got used to being under physio stress, and his heart developed extra blood supply to the myocardium, and that's what saved him. And that is what can save you. That is what can save everybody. That is what I've made plain in my paper. Now, I'll be submitting that at some stage to some authority that no doubt will try to shut me down. Over a period of 50 years, my program would save the lives of 3.8 million people, and it would save the taxpayer $115 trillion. That's a lot of money. Not something you want to carry around in your pocket and lose change, is it? Otherwise you'd have a heart attack. And if you weren't prepared for it, you'd probably die of it. Brothers and sisters, boys and girls, ladies and gentlemen, I'm not trying to frighten you. I'm simply telling you the way it is. When I became a cardiologist a long time ago, I dreamed of finding something. All cardiologists dream of finding something that we can pass on to the rest of the world. It looks like my prayers have been answered, and so now it's my job to pass it on to the rest of the world. That's why I'm making this video, and that's why I hope and I pray that you are listening. Now get off the couch. Put the video game down. Grab a ball and take your two sons outside. Go to the park and play football for an hour. Don't just do it now. Do it every day for the rest of your life. Remember, life is only worth living if you have your health. Believe me, if you have a widowmaker heart attack and your body's not prepared for it, you'll spend whatever life you've got left with nothing below the neck but memories. I'll be posting this video in any place that I can find to post it. And with it, I will be placing my paper so you can read it for yourself. Now, there's a lot of jargon in the paper, a lot of figures, numbers and things that you probably won't understand. Don't worry about that. Just read round those things and pick out the bones of it and set it alongside what you've heard me say here on the video, and you'll know what to do. Don't keep it to yourself. Pass it on, especially to your children and your grandchildren. We have a woke system in operation around the world. It's crazy, it's absolute madness, and it drives me insane when I think how stupid some people can be. I just don't know how some people can be that stupid with just one head. But they are. But here's the one thing where I'm going to take one of their phrases, one of their woke phrases. Everybody gets a trophy. And for everyone who participates in my program, everybody gets a trophy. The trophy is an extra blood supply to your heart muscle. It's a first-class ticket to good health and a long life in retirement. I hope you've enjoyed my presentation. You'll forgive me if I'm not a great actor. I'm not a movie star. But I do hope you'll respect that I am a fairly good cardiologist and I'm trying to save your life. Goodbye for now. God bless you.